Universal Health Coverage, or UHC, aims at providing everyone with needed health services without financially straining them. There are different policies in different countries. Unfortunately, the reality is that persons with disabilities still face many barriers and huge expenses when accessing healthcare. We are talking today to Aisha and John, who have agreed to share their experiences with access to healthcare in their countries. With us is also Fernando, who is a social protection expert. Good evening and welcome.
Good evening.
Can you provide examples of the healthcare services you need?
Right now, my main concern is my pregnancy, so I should have regular checkups with the obstetrician. Unfortunately, the nearest clinic is inaccessible, so I have to travel to another one far away. I also see the doctor quite regularly for my bed sores.
For my child who is deafblind, on top of the usual child illness, we really need habilitation. However, for such service, we need to travel to the capital. He is now 10, and unfortunately, with every passing year, it will be even more difficult for him. We are also struggling to get him the assistive device that he needs.
Yes, persons with disabilities need general health care such as general medicine, obstetricians, and dialysis like me. Also, specialized services like rehabilitation, assistive devices, and so on. And they are facing barriers to access both. First, the existing services are not accessible. For instance, there is no braille on the medicine I take, so there is always the risk that I will make a mistake. Or take an example of a deaf person who can enter the building, fill in a form, read a poster, but they cannot communicate with the doctor. Second, the specialized services are not even available, as John mentioned.
Overcoming those issues costs money. Can you give us more details on that?
As I said, I have to take an adapted taxi to the clinic, which is 12 kilometers away from my home, because public transport is also inaccessible. Imagine how much money and time I would save if the clinic close to my house was accessible. Also, wheelchair maintenance. Last year, I had to replace it and had to be without one until I had money. I also can't afford to pay for an assistant, so it was difficult for my husband and myself. For the bed sores I mentioned earlier, a special wheelchair cushion would help, but I cannot afford it.
Not only the specialized services are expensive, but the few time we managed to get to the capital, I had to pay for transportation, accommodation, and also take a day off and lose some income.
This is one of the major issues which is often ignored. On top of the direct medical costs for general and specialized services, which are rarely well covered, there are all those non-medical costs. For example, transportation, personal assistance, interpreters for deaf and deafblind persons, as well as loss of income because seeking care is time-consuming for them.
So from what you say, it seems that most of those costs are paid out of pocket by persons with disabilities and their families. I thought that with the UHC, costs were supposed to be covered.
Where I live, the healthcare services are supposed to be free for everybody, but I still have to pay a lot for my disability needs because assistive devices and all other costs that I talked about are not covered.
In my country, we have health insurance, which we have to pay for every year, but the government pays for the poor. The problem is it does not cover rehabilitation or assistive device. It does not cover also the costs of transportation and accommodation I mentioned it before. Also, many persons with disability do not qualify for the support because their families are not poor enough, even though they themselves have no money and still need a lot of medical attention.
In addition, there are a lot of issues with private health insurances. For instance, in my country, they refuse to insure me because they consider me a great risk.
So how can we improve the situation?
Well, First, better accessibility of healthcare services in general and the availability of rehabilitation, assistive devices, and other specialist services at community level. This would decrease indirect costs faced by persons with disabilities. Making transport accessible or providing personal assistance services will involve different ministries and will take time to develop. However, in the meantime, universal disability allowance and concessions like in Vietnam, Namibia, Fiji, or Georgia could help cover some of those costs. Then for direct medical costs, it depends on the system existing in the country.
Can you tell us more about those?
Yes, government can directly provide health care free of charge or for minimal cost, financed by the public budget. It can also be financed through social health insurance with subsidies for vulnerable groups. Considering the high costs for persons with disabilities, they should be a priority group for subsidies and support. However, in both systems, one of the key issues is that disability-specific health care is rarely included. Because people cannot pay for it, it reduces availability and makes the few existing services more expensive. It is therefore important that the universal health care package includes rehabilitation and assistive products. Many countries like Kenya and Maldives also have mixed financing approach where the Ministry of Social Affairs or a specific fund will cover some rehabilitation services or assistive devices that are not covered by the healthcare system.
And what about the problem of disability discrimination in private health insurance?
Here, the government should adopt legislation prohibiting such discrimination. This was one of the biggest issues in the healthcare debate in the USA. But let's not forget that most people in our countries cannot afford private insurance anyway.
Thank you very much to all of my guests.
Thank you.
As we have heard, persons with disabilities have to pay more for healthcare because of their higher needs and all the barriers they face. It may take a long time to solve all the issues related to accessibility of services. However, inclusion of rehabilitation and assistive devices in UHC policies, as well as social protection measures such as universal disability allowance and concessions, can really provide much needed support to cover the extra costs that persons with disabilities face today when seeking access to healthcare.